A mystery disease known as the gay plague has become an epidemic unprecedented in the history of American medicine.
They struck without warning, leaving pain, panic, and devastation in their wake. These illnesses were history's worst nightmares come to life. From fevered villages to entire cities wiped off the map, these diseases reshaped the world through fear. But what made them so terrifying? And could they ever return? Buckle up as we explore the 12 most terrifying diseases in human history. Number 12. Typhus. In ancient history, one other thing was common along with war, death, and famine, and that is disease. The typhus, however, is not just any kind of disease, but one that particularly follows war in different timelines. Popularly known as camp fever, war fever, or jail fever, typhus is an age-old disease caused by a bacterium known as Rickettsia prowazekii and is transmitted through body lice. The exact history of this disease is unknown, but records dating back to the Peloponnesian War in 430 BC showed an epidemic that killed several important people, including Pericles and his sons. The first description of typhus, however, came in 1083 in Italy, but it wasn't until 1546 that Girolamo Fracastoro, a Florentine physician, accurately described the disease. Years after Fracastoro's description, accounts of a disease that manifested as spots on the body, with fever and cold, emerged over centuries, with the death of those infected running into thousands. In the 19th century, however, the world saw the true extent of typhus when people of all social classes were struck with the disease. Ranging from 500 to 900,000 people, the number of dead and infected people climbed in just 60 years. Years later, during and after the First World War, an estimated 30 million people were infected with typhus, and about 3 million people died from it. This terrifying disease, as was later discovered, was very common during times of war due to the low hygiene and overcrowding, but the way it quickly spread was still an issue. Eventually, it became known that the disease was transmitted by body lice, and in war camps, it was almost impossible to control with the crowd. Within a short time, infected persons developed fever, headaches, chills, and body pains. The most prominent symptoms were rashes and macular skin eruptions that happened only a few days after infection. If the infection was not treated quickly with antibiotics, things would get worse, and the patient would develop kidney failure, pneumonia, and subsequently die. Compared to the early 15th to 19th centuries, typhus has been effectively controlled with antibiotics that have reduced the mortality rate, a situation that remains to our own benefit. Number 11. HIV/AIDS. Single-handedly, this disease is responsible for the deaths of at least 40 million people all over the world since its first discovery. But that is just the easy part. The hard part? Finding out the origin of the disease and how it spreads. Known as the human immunodeficiency virus, this disease attacks the immune system, weakening its defenses against invading infections, and ultimately leading to full-blown AIDS. The true scary part of this disease, however, is its ability to remain undetected in the body for months or years, as it slowly kills you from the inside. Originating from Africa, the HIV virus has existed for years, locked away in the genes of animals, particularly gorillas and chimps, but gradually it found its way into the human body and mutated. In the early 20th century, the HIV virus was believed to have infected Africans when they got injured while hunting infected animals. From the early 1950s, several people who had visited specific African countries were diagnosed with strange illnesses, but it wasn't until the 1980s that it became linked to HIV. In 1981, 5 men in Los Angeles, California, who were diagnosed with a rare form of pneumonia and cancer, set the stage for the disease that would shake the whole world. Months later, more men were diagnosed with rare diseases that were common in patients with weak immune systems. The disease was then named GRID, signifying gay-related immune deficiency, and was believed to only affect homosexual men. 2 years later, it was discovered that women could be affected too, and by the end of 1984, more than 7,000 people had been affected in the US alone, and this threw the world into a health crisis. With the virus attacking the immune system, It wasn't long before infected people were attacked by more diseases due to their weakened immune system. Because the world did not know better, those who were infected were stigmatized, with many dying from shame even before the disease took them. As time went by, more facts became known about HIV/AIDS, including its mode of transmission and window period. As of today, HIV/AIDS still has no cure, but there are drugs that suppress the virus, allowing infected people to continue living a healthy life. Number 10. Cholera. By constantly administering fluids, electrolytes, and antibiotic treatment, anyone can get better in just a few days after being infected by the bacterium that causes cholera. In the past, however, people were not so lucky and ended up dying so quickly before much could be done. Unlike most deadly diseases that required body contact or open wounds, cholera was built differently, as its mode of transmission was simple, yet deadly. All it took was for a water source to be contaminated with the bacterium Vibrio cholerae. Anyone who drank from it would be subjected to watery stooling and vomiting, followed by muscle cramps, acute dehydration, electrolyte imbalance, and subsequently, death within a few hours or days. Between 1817 to 1824, the first cholera pandemic struck India, and from there, it spread to other parts of the world, including Europe, Africa, and America. By the end of the 1800s, cholera had been a pandemic 6 times. But while all this happened, no one knew how the disease spread until John Snow, a British doctor, made a discovery during the third pandemic in 1854. Snow discovered that the disease was waterborne, not airborne, and he traced the outbreak to a contaminated water pump. Sadly, his discoveries were not taken seriously for many years, until his theory was proven to be true, and cities began to manage waste and clean water. From the time it was first discovered to date, cholera has claimed the lives of more than 40 million people, with thousands still affected every year. But that is not what makes it scary. From how fast it strikes to the time of death, if treatment is not carried out, it is calculated in hours, days at best. In extreme cases, patients lose so much fluid that their skin becomes wrinkled and their eyes sink. Fortunately, cholera has been controlled recently than it had been before, but it still thrives in areas of very poor sanitation. Even with modern treatment options available, the only way to truly fight cholera is by improving water and hygiene. Number 9. Rabies. Imagine being so sick that the sight, taste, or feel of water makes you hysterical. But at this point, anyone who is infected with rabies is certainly going to die. That is because by the time the clinical symptoms manifest in infected people, it is already too late for them to be treated. In ancient Sanskrit and Latin texts, the word rabies came from rabhas, or rabere, which meant violence or rage. Funny how it perfectly describes the mannerisms or symptoms associated with the disease. Known as far back as Mesopotamia and Greece, rabies is one of the oldest and most feared viral diseases ever known to man, and for good reason. In the 1st century AD, it was discovered that the disease was transmitted through the bites and saliva of infected animals, especially dogs, cats, and bats. But even then, the cure would not be discovered until the 1880s by Louis Pasteur, a French chemistry teacher. As a highly complex disease, one of the major problems is early diagnosis. When a person is bitten, the rabies virus travels to the brain and can remain dormant for weeks or months. Once the symptoms start to manifest, it is already too late to get treatment. In the early stages, it is commonly mistaken for other illnesses, so picture what happens when it goes untreated. The person becomes feverish, and then the symptoms graduate to nausea, vomiting, violent movements, fear of water, foaming in the mouth, and eventually, death. From historical records to date, only about 15 people have survived the disease, showing how deadly it is to diagnose and cure. While rabies is currently controlled today, it is still the cause of almost 60,000 deaths yearly, with 40% of those being children under 15. A stark reminder that even with all the advancements in the world, there are diseases that humans simply cannot control. Number 8. Tuberculosis. You may survive it now with better medical treatments and procedures, but if you had this disease in the 19th century, your chances of survival were very slim. Also known as the robber of youth or TB, tuberculosis was a menace in 18th century Europe, killing more young people than old, and earning its name. Results from a study in 2014 suggested that tuberculosis may have originally come from animals and somehow been transmitted to humans. However, traces of the bacterium responsible for tuberculosis have been found in a 500,000-year-old fossil, speculating that it may be older than we know. Regardless of the true origins, what we know is that tuberculosis existed at least 9,000 years ago in the Neolithic era. But whether it existed in ancient times or not, a constant factor is that it was deadly and treated as such. Caused by a bacterium called Mycobacterium tuberculosis, the disease was airborne, attacked the lungs, and could easily be spread through coughing and sneezing. Infected persons experience symptoms such as severe cough, tiredness, chest pain, coughing up blood, and fever. Back then, when very little was known about tuberculosis except the fact that it was contagious, infected people were isolated in facilities known as sanatoriums. There, they would stay until they died, which was very likely. In 1906, the first immunization against tuberculosis was developed by Albert Calmette and Camille Guérin, but the real treatment came years later in 1944. More than 80 years later, and tuberculosis still remains a threat, even with the presence of strong antibiotics to fight the disease. While no one prays for another epidemic, tuberculosis reminds us to this day that it haunts our world. Number 7. Malaria. A simple bug bite could cause an itch or, at most, a rash, but not in this case. Malaria, caused by a bite from the female Anopheles mosquito carrying the Plasmodium parasite, could send you into organ failure, brain damage, coma, or death. For a disease that is quite common and even looked down upon in regions like Africa, malaria is responsible for up to 50 million deaths throughout history. Going as far back as 2000 BC, references to malaria existed in ancient Chinese documents, clay tablets from Mesopotamia, and even Hindu texts. But the good thing about this phenomenon is that even with its history, there were ancient methods used to treat or control it back then. However, does this reduce its deadly nature? Absolutely not. In different parts of the world, malaria has been recognized as a health hazard with the potential to wipe out thousands or millions of people, depending on the region. The mosquito responsible for transmitting the disease thrives in swampy or waterlogged areas, and this places countries in warmer climates at risk. The bugs lay their eggs in the swamp, and once they hatch and bite anyone, they can transfer the parasite to the body. Once the parasite enters the bloodstream, it begins to attack the liver and red blood cells. The scary thing is that one can have the parasite in their system for months without feeling it, but when the symptoms manifest, it shows up as high fever, cold, vomiting, confusion, loss of appetite, etc. If left untreated, the patient can experience brain swelling, organ failure, and death. In history, bloodletting, amputations, and herbal medicines were treatment methods for malaria. Thankfully, no one has to go through that anymore, as there are better treatment options available today. Chloroquine, one of the most popular treatments developed in 1946, still remains a top choice for treatment. Even with treatment readily available, preventing the disease altogether is a much better option. Number 6. Ebola. Several diseases have existed throughout history, but only a few have inspired true fear, as Ebola did in 2013. Known as one of the deadliest diseases to have ever existed, Ebola first made an appearance in 1976 in 2 separate outbreaks. Initially thought to be transmitted through physical touch, the true nature of Ebola was revealed during the pandemic. Caused by the Ebola virus that is believed to be carried by the fruit bats, Ebola spreads through simple, direct contact with the bodily fluids or tissues of infected persons. At the time of the outbreak, health workers had to protect themselves in full body suits, masks, and gloves that covered their entire bodies. But despite how easily it is transmitted, the real problem is how fast one can go from healthy to dying once infected. You can be perfectly fine 1 minute and then battling internal bleeding and organ failure in days. At the early onset, the symptoms can be mistaken for the flu, leading to mistreatment. But in a short time, it progresses badly, damaging internal organs in the process. During the outbreak from 2013 to 2016, about 28,000 people were infected, with more than 11,000 patients dying because there was no cure. Ironically, people survived and recovered without a cure, with some people coming forward with claims of herbal treatments. During the last breakout, infected people were kept hydrated, as death usually came from shock due to loss of fluid. The bleeding, although not very common, was an indication of a worse outcome. Generally, people recovered on their own, and the ones who did were assumed to suffer long-term muscular and joint pain as well as liver inflammation. As of 2019, a vaccine was developed for the Ebola virus, and it was proven to be effective 10 days after being given. Now, 10 years after the outbreak that earned it the title of the most deadly disease in recent history, Ebola has not been eradicated. But with the Ebola virus still out there and waiting to strike again, it's a race we hope not to lose. Number 5. Bubonic Plague. How deadly did a disease have to be to wipe out half of the world's population? In the 14th century, the bubonic plague was so fatal that as many as 50 million people died from it. Around 1347, when it first struck Europe, it killed 1/3 of the population at the time, causing a worldwide panic. But the cause of the disease was not what anyone would have expected at the time. It all came down to bad hygiene in medieval times, as trash, animal dung, and even human feces were regularly dumped on the streets all the time. This led to the abundance and thriving of fleas, parasites, and pathogens in the city. The flea responsible for the transmission of the bacterium Yersinia pestis was one of those thriving at the time, and by jumping from humans to humans, the bacteria spread quickly. But that was only the beginning. The bubonic plague spread so fast and worked so quickly that in just 3 days, anyone infected would die. No one knew what the cause was, and no doctor could stop it, and gradually the disease spread like wildfire. Within days, families were wiped out and streets were emptied. But again, that was not all. The symptoms were horrible, manifesting as sudden fever or cold, and it was followed by buboes or painful swellings in the neck, armpits, or groins. The buboes were full of pus and blood and would turn black in days, leading to the phrase Black Death, a term the disease is also referred to by. If the patient was not treated, the disease would move to the bloodstream and lungs, making the wounds septic and causing pneumonic plague, an even deadlier variation. Eventually, the patient would die in the following days. Because of the living conditions of ancient history, the bubonic plague kept coming back in waves, keeping the world in fear for generations. Presently, the bubonic plague might no longer be a threat due to improved hygienic conditions, but the knowledge that it still exists in some parts of the world is enough to keep us all in check. Number 4. Leprosy. Traces of this disease date back 4,000 years, with records even existing in biblical books. But unlike most diseases of history, leprosy was not seen as a disease until not very long ago. The ancient Egyptians believed that leprosy was a divine punishment, or even a curse upon the person who suffered it, and as a result of this, the victims were treated as outcasts and left on their own to die. Not only were they forced away from everyone they knew, they were also made to wear bells that announced their arrivals, and were also forced to live together in colonies called leprosaria. Recent discoveries have shown that leprosy was neither a curse nor a divine punishment. Instead, it was caused by the bacteria Mycobacterium leprae, or Mycobacterium lepromatosis. The bacteria directly affect the nerves, killing the nerve endings and also affecting the skin and eyes. Because the disease affects the nerves, infected persons can lose sensation in their bodies and would not notice or feel injuries that can lead to loss of body parts. Additionally, the vision can be affected, as well as muscle weakness, leading to poor sight and weakness. The disease is contagious, but not as severe as you might think. Occasionally, people exposed to the bacterium do not develop the disease, but direct contact with the fluid from the nose of an infected person is enough to transmit the disease. When someone is exposed, it can take anywhere from a year to 20 years before they begin to notice the symptoms. And without treatment, the affected would suffer until they died or until they became horribly disfigured. Thankfully, times have changed, and leprosy can now be cured with a combination of antibiotics. The key, however, is early diagnosis to avoid the complete loss of nerve bundles. Although leprosy is not common anymore, it still exists with about 200,000 cases reported every year in Asia, Africa, and South America. Number 3. Smallpox. Among all the infectious diseases that were common in the early centuries, this is the only disease that has been totally eradicated. Globally recognized as the most devastating disease in epidemic form, smallpox was so serious that it was almost impossible to survive. Even if you did survive, the disease would leave you with scars all over your body and on your mind. Interestingly, smallpox is believed to have existed for at least 3,000 years. With traces of the illness found in the mummified body of an Egyptian pharaoh, it possibly dates back to 1500 BC. Caused by the variola virus, the first symptoms manifested as fever and vomiting. This was followed by the formation of mouth ulcers and rashes all over the body. In the days that followed, the rash on the skin would turn to blisters containing fluids with a dent on the center of each rash. The blisters would dry, fall off, and leave prominent scars on the body. Sadly, children were the most victims of this disease, and the mortality rate was as high as 30%. But even at that, it was highly contagious. By engaging in close contact with an infected person, you could get infected too, especially when they sneezed or coughed. There was one peculiar thing about smallpox, and it interfered with the mortality rate. Although smallpox is an umbrella term, there are different classifications of the disease. The ordinary form, which is the most common, has a 30% fatality rate, while the flat form has a 97% fatality rate. For the longest time, there was no cure for smallpox, only inoculation practices that has existed since the 10th century. It wasn't until 1796 that a vaccine was developed by Edward Jenner for smallpox. Years later, the world finally won its battle against smallpox, eradicating it in 1980. While smallpox no longer exists today, it remains the only disease to have been fought and successfully won over throughout history. Number 2. Polio. Poliomyelitis, or commonly polio, was one of the diseases that had devastating effects on the affected ones. And this was not because it had a huge death toll or was highly contagious, but because it affected the most vulnerable set of people in the world: children. Children under the age of 5 were the only people who were affected by this disease, and in the mid-1900s, when it was common, it became the fear of every parent. Caused by the polio virus, which is spread through contaminated food or water, the virus struck quickly and surely. One day, a child could be playing with their peers, and the next day, they would become paralyzed. In severe cases, the virus also affected the muscles that helped in breathing, causing the lungs to collapse and the patient forced into an iron lung. The worst part? No one was exempt, as it could happen to any child from any race, gender, or location. One of the well-known cases of polio was former President Franklin D. Roosevelt of the United States. But how long had this sickness existed, and how did it go normal to severe so quickly? Believe it or not, polio has been around for centuries, with depictions in ancient art showing us how people were crippled by a disease in infancy. However, the virus responsible was identified by immunologist Karl Landsteiner in 1909. The key to escaping polio was preventing infection, because once you were infected, there was no treatment. But at the time, when resources were limited and knowledge not so common, children suffered permanent paralysis and reliance on iron lung for breathing. Fortunately, Dr. Jonas Salk introduced the first vaccine in 1952, and the story changed. This change was followed closely by the development of oral vaccine by Albert Sabin, leading to the victory over polio today. With only a few cases in Pakistan and Afghanistan, polio has almost disappeared from the world, leaving behind a memory only few would remember. Number 1. Spanish flu. During the First World War, a new enemy emerged that was not a country. It was the Spanish influenza, or the Spanish flu, and it was deadlier than the war bombs or bullets. Despite the name, this disease did not originate from Spain, but in Kansas, US, in 1918. From there, it somehow spread to the rest of the world, including France and Germany, ultimately leading to roughly 500 million people being infected and about 50 million people dying. What made it so painful was the fact that it mostly affected young adults, eventually killing them after a long period of suffering. Victims experienced symptoms similar to regular flu that included headaches, fever, and sore throat. But in the second wave of infection, the symptoms took a different turn, causing bacterial pneumonia, which was the leading cause of death. In some cases, symptoms would also include bleedings from the nose and mouth, loss of hair and teeth, a oozing odor, and even insomnia. Within hours or days, patients could drop dead if they were not treated. Bloodletting and an assortment of medication were used by doctors to help relieve the situation. Sadly, there was only little the doctors could do to help, and this led to the painful death of more and more people. While some believe that this disease was a form of biological weapon to turn the tide of the war, very little information supports that claim, as the Spanish flu gradually faded from history, just as it had come. And although the original strain is long gone, scientists still study it to prepare for future pandemics that will hopefully never come again. Thank you for watching. See you in the next video.